Don't be nervous to make bold movements to capture these hard-to-reach areas. If there is any advice I can give to enhance your effectiveness during scanning, it's to always make bold and purpose-driven, smooth movements. Welcome to iTero School. Class is in session. Let's talk today about pretreatment scanning. Now, this could be for the patient's initial visit to your office or a scan to record information for study models, wax models, Invisalign treatments, or even appliances such as sports guards and night guards. Our patient today is a brand new patient. I'm selecting the new scan option. I'm going to allow it to load, and then I'm filling in all their information on this drop-down menu. Since we are scanning a patient pre-treatment today, I'm changing the case type to restorative. This option will allow you to send this case to the lab for a variety of pretreatment needs that I mentioned earlier. Due dates are set at a standard 2-week turnaround time unless you change that manually for rush cases. Then I'm going to designate this scan to be sent to Glidewell Dental Lab as the recipient. Now, the most important step here is to click on the pretreatment scan box rather than to leave that area blank. Let's get started with this live patient example and talk about seating position and wand technique. It is important to feel comfortable while scanning. The more I am straining while performing a scan, the more I'm going to start to get fatigued. My preferred position is roughly 12 o'clock in relation to the patient's body, and I'll position the scanner either to my left or right at 5 o'clock or 7 o'clock respectively. I'm holding the scanning wand in my dominant hand with my palm and fingers facing upwards. This initial hand posture is exactly the same whether I'm scanning the upper or the lower arch. My opposite hand is always standing by to retract, to suction, to provide a fulcrum, or even act as a stabilizing guide. As you can see, I have the lower arch selected on the left-hand menu. I did this by just pressing on the image of the lower arch. Saliva bubbles and any debris can be removed with an air blast and continued throughout the procedure if you need to. Starting distal to the most posterior tooth in the arch, I'm going to initiate the scan by tapping on one of the buttons found on each side of the wand. On this first pass, I'm attempting to acquire occlusal records only. This patient does have both third molars present, so it's really up to you which side to begin with and feel the most comfortable. As I'm wrapping around to the anterior of this arch, I need to stay more lingually inclined rather than looking straight down at the incisal edges. We're going to come back and recapture the incisal edge details later. A little side-to-side motion while moving along the occlusal surfaces of the molars helps the wand to easily move past the cheeks and the lips, especially if you're getting hung up there. Now, once you've made it all the way around the arch, go ahead and just stop the scan by again tapping one of the buttons found on the side of the wand. I just want to review what we've already scanned up to this point, and I'll tip and turn the scan here to show all of the red areas that have yet to be acquired. So starting once again from the distal of the most posterior tooth on each side, I'm going to scan the lingual next. However, I need the scanner to recognize where I am and pick up the previous scan where I left off. So, I'll start on the occlusal surface first, scan for a few seconds, and wait until the old and new data meshes together. Now once the previous scan appears on screen, I can turn the wand to the lingual and start to move it around the arch. I'm most concerned about scanning the embrasures and undercut areas of the lingual now. As you can see, I've turned the wand so it faces almost straight up to the ceiling, and I will twist it with both hands if I need to, laterally left and right as I move along this arch. Don't be nervous to make bold movements to capture these hard-to-reach areas. If there is any advice I can give to enhance your effectiveness during scanning, it's to always make bold and purpose-driven, smooth movements. Now that I'm coming around to the distal lingual of the opposite side, I'm going to stop the scan once again and review it to make sure there are no missed spots. This scan looks clean, so I can continue to the buccal. For the buccal scan, I'm going to do it a quadrant at a time and stop at the midline. Starting from the distal of the most posterior tooth in the arch, I'll once again scan the occlusal until the previous scan meshes together. Now that the full image is displayed, the wand rocks to the buccal and moves towards the midline, staying as close to the teeth as possible. To reach the difficult interproximal areas here, instead of the twisting method we used on the lingual, I'm going to lift the tail end of the wand up and down while progressing towards the stopping point at the midline. Just taking a quick look here before moving to the adjacent arch, and everything looks to be in order, so I'm going to go ahead and move on. Now I'm always starting on the flat occlusal surface, allowing the scans to mesh, and then I move along the buccal in the same fashion towards the midline. Give every segment a quick check to make sure you get the right information recorded. The last bit of info that you need to scan for full arches are the incisal edges. You are always going to make this the last step after all other surfaces are completed. All we need to do here is rock the wand, buccal to lingual over the incisal edges, once on the right and once on the left to capture the edge details. Like I keep saying, I still want to start on a flatter posterior surface to help the wand mesh the scans together. Maybe just start on the bicuspids until the mesh happens, and then rock the wand buccal to lingual, moving towards the midline. Make this scan last no more than 3 to 5 seconds, and then review the final scan to make sure it's complete. When manipulating the scan on screen, there are a couple options you have to view all angles of the scan. Using one finger, moving around on the screen will rotate the scan on its axis without actually moving it around from its centered position. Holding 2 fingers on the screen will allow the scan to move to a new location. However, the scan is not going to tip and turn.